It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. After days of protests in Los Angeles over President Trump's immigration crackdown, the administration has deployed 4,000 members of the California State National Guard and hundreds of active duty Marines.
Wisconsin Governor Tony Evers signed a letter speaking out against the deployment, calling it an alarming abuse of power and stressing the importance of a state's ability to manage their own National Guard.
And here is California Governor Gavin Newsom on NPR's All Things Considered earlier this week.
My warning to every governor, regardless of your political stripe, is this is a preview of things to come. And I pray for only one thing, and that's peace. Peaceful protests.
Protests are planned around the country on Saturday, including in Wisconsin cities. John Hall joins us for a look at the deployment and the possibility of it happening in Wisconsin and elsewhere. He's a military historian and professor of U.S. military history at UW-Madison and a retired U.S. Army Reserve colonel. John, thanks a lot for joining us today.
Yeah, I'm happy to be back on.
Big picture, John, in the scope of American history and how National Guards have been used and active duty troops, how unusual are the deployments of the last week?
Well, they're very unusual by the light of recent history. And anybody who's been following this story will have read many times by now that this is the first time that Guard forces have been sent into a state over the head of the governor of that state since 1965. And so this is unprecedented with fairly limited hindsight. If we go back further in history, it is far less unprecedented, specifically in the era of the late 19th, early 20th century with a lot of labor unrest and other riots. Presidents were a little bit more willing to invoke this authority than they have been in the post-civil rights, post-Vietnam era.
Let's zoom in on the National Guards in states around the country in particular. They are at the state level, but obviously there's federal authority over them. What's the division of authority?
Well, the division of authority is generally defined by the Constitution. And I should point out in your introduction, you correctly identify me as a military historian, so I am not a lawyer or a legal historian, but my own expertise covers the era in which some of the most formative events that influenced this policy came about, to include the framing of the Constitution. And generally speaking, the Constitution leaves to Congress the responsibility for calling forth the militia, what we today call the National Guard. But Congress decided very, very early in the lifespan of the nation to delegate that constitutional authority to the President of the United States. And with that delegation, first in 1792 and have been updated periodically over U.S. history, the president can, under different sections of U.S. code, where Congress delegated this authority, call forth the militia or the National Guard on his own. But there are different sections and different standards under those various sections.
Right. And looking at this situation in California, the governor would usually, I think, in a situation like this, be the one to take the lead on deploying the National Guard. The president moved more quickly, called out the National Guard there. Are there standards that say this is when a president can do this? When a president should do this, apart from the legal side of things? What are the steps that are usually taken in a situation like this?
Sure. I mean, it's helpful to keep in mind that the original context, right, in which Congress decided to make this delegation of authority was an era in which Congress would go into recess and be days or weeks away from the national capital. And the idea was the president cannot sit on his hands if a foreign force invades the United States, waiting for Congress to come back to New York or Philadelphia and eventually Washington to authorize him to do this. So it really was almost a response to technological incapacity of that era. And different emergencies over U.S. history have refined the standards for doing this. But generally speaking, either section that the president might invoke, the one he has or the one that he has teased he is considering invoking, the so-called Insurrection Act, generally speaks to the same sort of conditions of invasions or rebellions, unlawful combinations, things that prevent the execution of the laws of the state or the federal government.
That's the National Guard, and we think historically the National Guard being used in mass riots and things like that. Active duty troops, though, Marines. It seems like in American history we've been more reluctant to use active duty military for, in effect, law enforcement and security purposes.
Absolutely, and with very good reason. So the nation was founded with a congenital fear of what they then called standing armies. The idea that regular armies, soldiers kept under arms and in uniform and under military discipline in times of peace, historically had shown themselves to be the tools of tyrants. And so the founding generation did not want such an army. Early security concerns had caused them to kind of get over principle for practical reasons, and they did eventually build and keep something of a regular army that grew over time. But the bar had always been higher for the deployment of regular troops in this regard, because the militia, of course, in its earliest days was comprised of friends, neighbors, etc. This was seen as less of a threat to civic liberty and freedom, to have a force comprised verily of your neighbors that was sort of the go-to emergency force if there was some kind of unrest that regular law enforcement was not able to respond to, whereas the regular forces of the United States were potentially very, very threatening. And so a lot of the debate that's going on right now about the current deployment sort of hints around the concerns of this historically. But the one thing that it misses, I think, is that the regular forces of the United States have wanted to stay far, far clear of these kinds of deployments throughout history because they have always understood the heightened suspicion, and particularly in the earliest chapters of American history, leaders of the Army in particular knew that they were on perennial probation, right? That they were sort of lucky to exist, and all they had to do was provoke fears of standing armies depriving people of their liberties, and that the institution could be deprived of its existence by the mere stroke of a pen in Congress. And every time that the Army has been, and now, of course, we're talking about Marines being deployed right now, so I'll expand that to any sort of force that might be deployed under such circumstances. Past cases in which they have been deployed in this manner have really put them in the the crosshairs of acrimonious political debates where they do not like to be. And particularly post-Vietnam, it took the military a generation to rebuild public trust, and they are very, very chary of squandering that public trust by being thrust into circumstances like this.
John Hall is with us, military historian at UW-Madison, looking at the Trump administration nationalization of some California National Guard units and the deployment of active duty Marines there. John, the question I think in all 49 other states is, could this happen here with the justifications the White House has given? Could we see something like this if there were protests here in Wisconsin?
I think absolutely, largely because the President of the United States has said that this is something that's possible, as has the Secretary of Defense. He has made clear, moreover, that his definition of what constitutes unlawful combinations in terms of protests is relatively low. And so where protests emerge, he's threatened he will take similar measures to respond to those protests. Moreover, he seems to be suggesting that states and municipalities that, in his judgment, are interfering with ICE's mass deportation efforts right now are themselves obstructing the laws of the United States. And in sort of an ironic symmetry with the civil rights era invocation of these particular authorizations under the law, what you have here is an executive in Washington who thinks that states and cities are being obstructionist, and hence he needs to concentrate power and deploy forces to make sure that they are executing federal law that they seem reluctant to do.
One practical question, John. Again, getting back to the active duty versus National Guard issue. National Guard, when I've talked to leaders there, they're kind of a Swiss Army knife, right? They might help us during COVID with voting. They might deploy for civil disturbance. They might deploy overseas. They have some kind of training relevant to this. Active duty troops, the Marines, do they have a background? Do they have training when it comes to handling protests?
Not generally. It would be specialized training in preparation for a particular contingency or mission. So, quite right. The National Guard is sort of a Swiss Army knife. It's another one of the reasons why it is the force of first resort when the local capacity of law enforcement has been superseded or exceeded, and you need to enhance that capacity or you need additional capabilities. The National Guard is very well integrated with other state agencies, and the troops of the National Guard, depending upon their specific specialty, may be trained in how to respond to riots as a matter of course, and historically that they have done so. Not to say that they are beyond criticism in this, of course. Two of the most regrettable events in the history of the National Guard were in 1970 with deadly shootings at Kent State and Jackson State. But that notwithstanding, the National Guard is generally more competent in the measured use of force to respond to these kinds of emergencies, whereas within the active duty component, the Title X forces, Army or Marine Corps forces that might be deployed for this, that's not generally what they train to do on a day-to-day basis if they get orders. So, for instance, during the 1990s, when there were a lot of deployments on peacekeeping operations, U.S. forces deploying to Haiti, for instance, trained extensively in how to respond to civil unrest, how to use a measured escalation of force. But they have to go through a train-up period. And, the train-up for that deployment to Haiti, for instance, lasted months. So if active duty forces are mobilized and sent into a city overnight, it is highly unlikely that they're going to have that kind of training regimen to prepare them for it.
John, thanks for joining us today.
Yeah, my pleasure.
That's John Hall, military historian, professor of U.S. military history at UW-Madison, looking at the deployment of active duty troops and nationalized National Guard units in California.
Coming up, the spread of the sexually transmitted infection syphilis remains high, and the state surveillance coordinator is trying to reduce the stigma.
But our main job is, I guess, to put ourselves out of a job by locating patient zero and actually making sure that we're able to stop the spread of the disease.
The latest on syphilis prevention, that's next on Wisconsin Today. It's Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Ferret. Preliminary data released by the state health department finds that the number of Wisconsin babies born with syphilis last year is more than 15 times the amount born with the disease in 2019.
Congenital syphilis can be life-threatening to fetuses and newborns. It occurs when the sexually transmitted disease passes to babies during pregnancy.
This comes as syphilis rates in Wisconsin and nationwide have risen sharply in recent years. Data from the state health department finds that cases of syphilis more than tripled from 2019 to 2022. Cases dipped slightly in 2023, but infections remain high.
To learn more about the rise in this sexually transmitted disease and what's being done to contain the spread, we reached out to Craig Berger, syphilis surveillance coordinator at the State Department of Health Services, and Dr. Allison Linton, who specializes in obstetrics and gynecology. She's an associate professor at Froedtert and the Medical College of Wisconsin. Dr. Linton finds that the rise in syphilis rates in our state is likely due to a combination of factors.
I'm not sure any of us fully know the full answer. It's likely multifactorial. It definitely seems that the COVID-19 pandemic played a role. So if you look at rates of syphilis in particular since 2019, you've seen a large increase. And so whether that could be partly due to people not having access to routine STI testing during the COVID-19 pandemic, or being a little bit more wary to see their healthcare provider, I think that there's probably a lot of different reasons. The other reason why syphilis is somewhat unique Because syphilis can have symptoms initially, but after those symptoms go away, someone can still be infected and be able to pass the infection to other people. So because of that, there are some people that may have had an infection or symptoms initially, and then they went away and they don't realize that they are still infected. So as those asymptomatic infections continue to exist, you can start infecting more and more people over time.
And Craig, how does the rate of syphilis cases compare to the spread of other STIs like gonorrhea or like chlamydia?
So the gonorrhea and chlamydia have actually been mostly on the decrease. We did see a slight bump up over the COVID pandemic. However, syphilis has been on an upward projection up until 2022, when we had our highest count of 1,916 cases. In 2024, however, and this I'm talking adult or acquired syphilis, we had in 2024 we had 1,419. So I think we're over that hump and we're working our way down.
And now the state health department is looking at this preliminary data from early 2024 showing that the rate of babies born with syphilis passed during pregnancy, congenital syphilis as it's called, was nearly 15 times higher last year than in 2019. What is behind that uptick?
I think a lot of it was from early testing. Again, I don't want to blame everything on the pandemic, but as the doctor alluded to earlier, a lot of our community partners, Vivint, Planned Parenthood, other community partners that do testing for STIs were shut down, focused on other things during the COVID pandemic. And I think we fell behind and we're kind of playing catch up right now.
Dr. Linton, are there birthing complications for the mother or the newborn with congenital syphilis?
Yeah, absolutely. Congenital syphilis is a very severe disease and something that we certainly want to detect and be able to treat, because I do want to emphasize syphilis is treatable. It is curable. We can oftentimes treat it with just a series of antibiotics. But unfortunately, if it's left untreated, adults can progress in symptoms. They can develop, long-term symptoms where they can have neurological problems, damage to various systems of their body. From a congenital perspective, when that bacteria passes through the placenta, it leads to very high rates of stillbirth. So about 50% of pregnancies can end in stillbirth. And then even when those babies are born, you can see complications such as bone issues, blindness in a newborn, rashes, a variety of different conditions. So definitely something that we want to detect and be able to treat as soon as possible.
Are you able to treat the pregnant person once you learn that there is congenital syphilis?
Absolutely. Yes. So, and that's one of the big things, like Craig was saying, we're really trying to focus on making sure that we can bring these numbers down. And one of the ways that we're doing so is changing our routine ways of screening in pregnancy. So, historically, there were recommendations that we only screened pregnant people that are at higher risk. Now, those recommendations have changed dramatically to recommend that all pregnant people are not only screened, but screened 3 times during pregnancy. So, screened at their initial prenatal visit, one time later in the second to early third trimester, and then once again at the time of delivery.
You alluded to this earlier here that, syphilis has also been called the great imitator due to the wide range of symptoms for this particular STI. Is misdiagnosis still an issue?
Syphilis, at least primary and secondary syphilis, which are usually when people have initial symptoms, are somewhat classic as long as you're seeing a physician or, seeking healthcare. I think what's tricky about it is, again, because sometimes these symptoms can be very mild or even unrecognizable for some patients. Some people don't realize that there's something that needs to be tested, and they wait, and a lot of times the symptoms will go away on their own. But like I mentioned, those symptoms going away does not mean that the infection is still not present, and they can lead into this latent phase where the infection is still within their body. They can still transmit it to others, including during pregnancy, but they no longer are feeling the symptoms of it and might not realize that anything's wrong.
Dr. Linton, going back to newborns with an STI, what are those first months like if they survive?
So generally for congenital syphilis, usually symptoms will start to develop within the first couple of months of life. So usually in the first 3 months, and for the vast majority of cases, you'll see something within the first 2 years of age. So we're watching babies really closely, infants really closely after delivery. Again, the more information we have, the better. So if we are finding out earlier in pregnancy or even at the time of delivery, that's something that we can then work with our pediatric colleagues to make sure that that baby is not only being monitored but treated for any signs and symptoms that they are having. But again, it's one of those things that the more information that we can have, the earlier, the better. And that's where really routine screening is so key. Every single person 3 times in pregnancy is the recommendation because of these numbers that we're seeing.
So, Craig, what do you focus on in your work as syphilis surveillance coordinator? What does that entail?
So part of my job as a syphilis surveillance coordinator is my side job as a intervention specialist, which means basically when somebody has positive labs for syphilis, we'll reach out to the provider, make sure that they ran the correct laboratories that need to be ran, because it is a pretty complicated algorithm, and so we make sure that and doctors haven't seen a lot of syphilis previous to 2020. So we make sure that everything's being run correctly, and then we tell them what they should be treated with. There's only 2 things that are available for treatment for syphilis in Wisconsin. That's penicillin or doxycycline. We always prefer penicillin. And then what we do is we talk to the patients and make sure they know what they're going to go through, what the treatment is, and answer any questions they might have. And then we also talk to them about their partners, and we actually go out there and we will find their partners and notify them confidentially that they need to be tested and treated as well. So we do a lot of talking. We try to remove a lot of shame and stigma associated with STIs, and even if a lot of times we'll talk to people who have multiple morbidities, multiple diagnoses at the time, including gonorrhea, chlamydia, and HIV. And we'll actually talk them into getting them into care, finding the right care for them that works for them. But our main job is, I guess, to put ourselves out of a job by locating patient zero and actually making sure that we're able to stop the spread of the disease. One of the things that we can celebrate is that in 2024, even though we did have 31 preliminary numbers for congenital syphilis, due to intervention, we were able to stop 86 congenital syphilis cases from occurring because of the intervention that we do here.
Nearly a year ago, Craig, the Food and Drug Administration approved a rapid at-home test for syphilis. Has that helped lower barriers for detecting syphilis?
It can in some instances. The rapid tests detect antibodies so that once somebody has had syphilis, they will have antibodies in their system for life. It doesn't mean that they have syphilis. It's just that those antibodies there that were produced during their infection will go with them for life. So we need the combination of tests to really find out whether or not there's going to be a reinfection. But for the quick screen, I think it's been very good.
Dr. Linton, Craig mentioned the antibiotic doxycycline, that it could be effective in reducing the likelihood of getting bacterial STIs like syphilis. What do you see there?
So there's the treatment after someone's infected. There also are new treatments where you can actually use something like doxycycline ahead of time. So for post-exposure prophylaxis, before you've actually been diagnosed with a infection, using a series of antibiotics to try to prevent the infection from truly taking hold in your body. So there's a lot of really wonderful work happening in the field of STIs right now. It all just comes back to the idea of making sure that patients are, one, aware, and that people are aware of symptoms, also aware of the importance of routine screening. So even if you don't have symptoms, making sure that you're getting those tests, that you're having those conversations, not only with your physician, but also with your partner. Like Craig was saying, a lot of this is about having open conversations with partners, making sure that you're assessing your personal risk as well as the risk of those around you to keep both you and them safe.
But do you find that there might be a reluctance for a patient to talk with you about an STI, or do you feel there are stigmas with STIs?
Yeah. Unfortunately, yeah, there's definitely still stigmas around STIs. The more we can work on this as a community, the better we can hopefully get those numbers down in syphilis to where they were before. As you mentioned, they were almost eradicated. The numbers were very low. And I think that's part of what we're seeing now because it was an infection that we weren't seeing as frequently. Like Craig said, there are a lot of physicians that aren't used to seeing syphilis. We weren't routinely screening because we didn't think that the risk was high. So the more conversations that we can have, the more that everybody can be up to date with what we are seeing in today's day and what we need to be looking out for. My goal is that not only can we decrease the stigma, but ultimately decrease the burden on society and on patients' health as well.
We're talking about syphilis and prevention in Wisconsin with Dr. Allison Linton and Craig Berger. Dr. Linton is an OBGYN and associate professor at Froedtert and Medical College of Wisconsin. Craig Berger is the syphilis surveillance coordinator at the State Department of Health Services. Who might be most at risk for contracting syphilis?
We have a lot of priority populations that we look towards. I can say that breaking down information from 2023, 2024 isn't complete yet, so this is from 2023. But by race, Black people in Wisconsin only have 6% of the population overall, but yet they had 51% of the disease burden. Vice versa, white people had 80% of the population and 28% of the disease burden. So again, there is a lot of system problems that exist that need to be overcame. Not to mention just folks who are on and underinsured, needing these systems to help them navigate them.
Dr. Linton, do you have insights on the risk of getting syphilis and how you have these conversations with your patients?
Yeah, I mean, I think that, again, one of the things that I thought was really interesting in some of the 2023 data was when we are diagnosing people with syphilis, over half of the cases seem to be in this latent phase. So where their initial symptoms had already resolved, and then they were potentially unaware that anything was wrong because they weren't having any symptoms. So I would just go back to that idea. We need to get back to a point where routine screening and routine conversations, like Craig was mentioning, are the norm. Making sure that this is not stigmatized. This is not something that we talk about behind closed doors and in hushed tones. This is healthcare. This is routine taking care of your body and taking care of your community and your families as well.
Why did efforts to eradicate the disease fail in the 90s?
I think it's hard to say. A lot of these sort of silent, occasionally, again, sometimes people will have symptoms initially, but if symptoms then disappear, just like any other disease where you are not having, or any other infection where you're not having outward signs, it can spread very quickly. And I think one of the things that is interesting, if I look back to my training, it was very common when people asked for STI screening, we would routinely do gonorrhea and chlamydia. We would not necessarily do syphilis because at the time, those numbers were lower. But that is going to take a whole re-education of not only the community to be aware of what symptoms and signs to be looking out for, but also the medical community for what we should be talking about, what we should be offering as routine screening. So I think if any of these sort of epidemics or changes in numbers over time, if you look at the epidemiology of a lot of infectious diseases, there's a variety of factors that can play a role for why you'll see ebbs and flows. But I think it all comes back to the same idea of increasing awareness, increasing the normalcy of being tested and screened even when you aren't having symptoms, and again trying to get the best data that we have to make sure that everyone can be as informed as possible.
Are there myths about syphilis that you have to demystify?
Yeah, I think, similar to what Craig was saying, I think all of STIs just have a lot of shame and a lot of misconceptions. I think one of the things that I always try to emphasize specifically about these bacterial infections is that they are treatable. It's not to say that they can't have secondary, complications, specifically, gonorrhea and chlamydia. Certainly we see impact on reproductive health systems. It can lead to higher rates of infertility. But syphilis, it's one of those infections that as long as we can diagnose it and we can treat it, people go on and have completely normal lives, right? This is not something that is a lifelong disease. So I think one of the things is, again, like Craig was saying, just emphasizing that this is not something to be ashamed of. This is something to help us get treated, we can help you get treated, and then help us identify other people that may be at risk. I think the biggest thing that I sort of see from the syphilis symptoms in particular, you had asked earlier, sort of a great mimicker, the symptoms that people may have in primary syphilis, a chancre, a sore, most commonly on the genital area, unlike something like a herpes infection, it is usually non-painful. So I've had patients come before thinking that this was just, from a friction or a rug burn. I've heard people described it as a rug burn before. So again, it might just not be something that they recognize as an issue. In secondary syphilis, sometimes it's a rash that people might have. So again, it's just all about having those conversations, making sure that people are aware, and that the goal is to help all of us help each other to decrease these numbers.
Dr. Linton, thank you for being here.
Thank you.
And Craig, thank you so much. Appreciate your time.
No, thank you.
And that is Craig Berger, the Syphilis Surveillance Coordinator for the State Department of Health Services, and Allison Linton, a doctor of obstetrics and gynecology and an associate professor at Froedtert and the Medical College of Wisconsin. They were with us to discuss the rising number of babies born with congenital syphilis in Wisconsin. It can cause serious health problems without treatment. Syphilis was nearly eliminated in the U.S. about 20 years ago, but infections have soared in recent years. And for disclosure, Froedtert and the Medical College of Wisconsin are a business sponsor of Wisconsin Public Radio.
Still ahead, Indigenous writer John Hickey's debut novel is set in Wisconsin's North Woods with a tense, fictitious tribal election.
When I came across tribal politics as a subject, this is like the central place where identity and belongingness is defined and codified.
The book is called Big Chief. A conversation with the author is next on Wisconsin Today.
It's Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. A new book set in Wisconsin's North Woods is an account from inside a fictional, tight-knit Anishinaabe tribe called Passage Rouge Nation.
The tribal community is fighting amongst themselves for political power in the days leading up to an especially tense election for tribal president.
The story is told through the eyes of Mitch Caddo, a young lawyer who runs the tribal government alongside his childhood friend and current tribal president, Mac Beck. The book follows Mitch as he and his opponents try to sway the vote of the people of Passage Rouge by any means necessary.
John Hickey is an enrolled member of the Lac du Flambeau Band of Lake Superior Chippewa Indians, and he's a UW-Madison alum. He joins us to talk about his debut novel. It's called Big Chief. John, welcome to Wisconsin Today.
Thank you. It's very exciting to be here.
When you were thinking about when you started conceiving the fictional Passage Rouge Nation, are there elements of the tribe or the reservation that were actually inspired by your time with your own tribal community, the Lac du Flambeau?
Yes, I think that when I began the book, that nation was going through quite a bit of turmoil. Better now. But it is inspired by that. It's inspired by a lot of the other reservations in Minnesota, Wisconsin that I came across in my research and through my observations.
You talk about the banishment and, blood quantum, like who is banished, thrown off the reservation for not having an adequate tribal bloodline connection. How do you make this type of belonging a central tension of the book?
I realized I was always writing about belongingness in, my previous short stories and novel attempts. And I think that, when I came across politics as tribal politics as a subject, this was the central place where identity and belongingness is defined and codified in official terms. And, as you brought up, blood quantum and enrollment is such a heated issue. And it cuts right to the bone because it defines who you are and how you belong to a people. And that just struck me as, when I was doing my research and I was encountering these things about disenrollment and banishment, it struck me that this was as close as you can get to, just harming somebody's sense of themselves.
John, let's talk more about Mitch Caddo. He runs this casino on the reservation. He's pretty fresh out of law school. And he's also running this re-election campaign for his childhood friend. You label him in some parts of the book as the J. Crew Indian. What is Mitch's work like?
Yes, the J. Crew Indian. In the beginning of the book, he sets it out that he's doing a lot of the day-to-day, maybe the more boring side of the governance work, while Mac gets to be a sort of figurehead, a sort of symbol. And in that way, he feels like this is his way of insinuating himself back into the community that he feels somewhat estranged by, because he is an outsider. He has left the reservation. He is seen as somebody who is different for many reasons, just visually, the way that he talks, the fact that, he spent so much time away from that, from Passage Rouge. He feels marked as an outsider, and this is his way of fixing that.
He's always, trying to feel the spirit of his mother. Ronnie, a social worker, she ran the tribe's family services department. She's killed in a really terrible car accident that you set up right away in the beginning of the book. And Mitch just can't feel his mom's spirit. What does that do to him?
Yeah. A few things. I mean, it is a very, she is, of course, the central parental figure in his life. His father's not in the picture. So he does lose that sense of family, right? He doesn't have a center. He doesn't have a moral center, because I feel like she's the source of, whatever moral compass that he has. On a very elemental level, she's his connection to the community. She's the last, family that he knows about on the reservation. So without her, he's feeling unanchored, and that's one of the main things he's trying to do throughout the book is heal that disconnection, find ways of replacing that source of connection.
Another woman in his life is Layla. Mitch and Layla, they grow up around each other on the reservation. Mitch is taken care of by Layla's father, and, they have love interests there, but why do they seem to get each other so deeply, but that it doesn't work for each other at the same time?
They do share, let's say, certain ambitions, maybe a certain unease about being, I suppose, young and educated and living on the reservation and trying to find a spot, find their place within that milieu. They share this contradiction with themselves, which is that, you want to be in this place, you want to have this connection, and yet you also want to be out in the world, and, balancing those competing urges, I think, unites them. But the way that they see see the solution to that is probably a little bit different.
Mitch is so thoroughly exhausted in the span of these 5 days. I mean, he's going through a lot. I'm wondering, as a writer, did you feel that exhaustion inside of you as well?
It took me a few years to write this book, so I feel like there were a few
exhaustion.
times. Yeah, I always say that I started this book the same year that my first son was born, like in 2016. So I would not be surprised if my sleepless nights somehow translated into the pages.
Is there a character you like the most in this book, or a character who evolved for you and you now gravitate to?
Mac was one of the biggest surprises to me as I wrote these drafts, because he was not a central character in the very first draft of this. He started to get more lines, a little bit more time in scene with each revision, until a certain point where I was realizing that as the writer, I was calling him in to, to liven up the scene. And I was like, wow, this guy seems more like the main character here. And of course, once I let him in a little bit, Mac just completely took over. But it's more than that. It's the arc that he has throughout the book. The more that I learned about him, the more I was just fascinated by how, you have this character who, is kind of a bomb thrower. He delights in trolling people a little bit. But he's also got, these very, very strong griefs that he hasn't gotten over. To some extent, the things that he's doing are meant to address these wounds that he's carrying around.
We're talking with author John Hickey. New novel is called Big Chief, and it explores themes of identity, belonging, and tribal politics. It's set on the fictional Passage Rouge Reservation in Wisconsin's North Woods. John, you paint such beautiful and very chilling images of the brutal, Wisconsin winter. Can you read a passage for us and give us a taste of that?
Certainly, yeah. Part of writing this book was I've been in San Francisco for 16 years, so I was trying to call up the memories of what it felt like to be in that winter. So here's a passage. You're a lone black figure on a field of white. The snow is falling harder, and somehow it's falling sideways and hitting like double-aught buckshot. This is the deceptive beauty of the Passage Rouge Reservation. Its beauty slipping into grotesque terror while you watch helplessly. Yesterday was so sunny and warm. Tonight it's winter, baboon, coming with both barrels.
So the cold and the snow and that chronic shiver that follows Mitch Caddo, throughout the book, there's the contrast, though, with the images of fire and the bonfires and the sacred fires and fireplaces. What do those two elements mean thematically?
It felt like, we could draw some, maybe some easy conclusions, that the fire is the warmth of family and love, and the cold is the rejection of the same. Like I said, like a lot of this was, for me, writing from such a distance, was re-experiencing what it felt like to live in a place like Wisconsin, like Minnesota, up north. So dealing with the subject, which is a lot of extremes, political extremes, the extremes of violence. I was drawn to these descriptions of extreme cold and extreme heat.
You had to persevere in this book. There were much longer iterations of this novel, and I'm wondering how you stuck with the writing process, and if you have any tips for rewrites and taking that feedback to collapse and edit and go shorter.
I mean, some of it is ignorance of what's left to come, right? That if I thought about all the work that I had to do in the beginning, then I'd probably find it more difficult to persevere. I always say that the one thing you cannot teach in a workshop in a creative writing program is patience, and just being able to sit in the discomfort of having this thing that's not complete. It's not something you can really study, but that's just the only thing that gets you through, is just having this patience. And I've been doing this it's been about 20 years since I started graduate school. So time has a different meaning than when I began.
After finishing this writing project and this book, do you feel differently about the Lac de Flambeau, or do you feel any different connection now that you have finished this?
Well, I'll tell you, in regards to the book, I was worried that I got something completely wrong, and that somebody who is from the area, or somebody who has worked in tribal government, was going to come to one of my readings and embarrass me or say something mean to me. But it's been really great to have these people show up at the readings to tell me that they found something that they identified with, or that they were happy that this story had been written, because they don't see it in other places. So I think that's probably made me feel a little bit closer to the people. I haven't been back since the book came out, so I don't know.
You don't know the fallout?
I don't know how that's going to go. My brother went, and they were asking, "Are you the author?" And he said no, and I don't know what they had in store for him if he had said yes. So to be determined.
As we close, can you talk a little bit about the cover and the design of the cover and what it means to you?
One of the things that I always said, I'm an indigenous writer, or I'm a writer who's indigenous. And I always assumed that they would put a feather on my cover. And
which they did, yes.
Which they did. It's
in
right
the
there.
right corner, yes.
It's rather tasteful, I think. But in a way, as I was considering it, I wrote a book about people that are very concerned with surfaces and symbols and images. And when I was looking for a cover, I wanted something that used maybe familiar iconography, over-familiar iconography, and reclaim it in a way, in a sort of ironic way. The name of the book is called Big Chief, so it's playing with some of those preconceptions and symbols in a way that I think reclaims them.
John, what a pleasure. Thank you so much for joining us.
This was fantastic. Thank you for having me.
John Hickey is an author from Minnesota. He's an enrolled member of the Lac de Flambeau Band of Lake Superior Chippewa Indians in Wisconsin, and his debut novel is called Big Chief. It's a political drama which takes place on the fictional Passage Rouge Reservation in the North Woods of Wisconsin.
On Monday, we mark the birth anniversary of Les Paul, the Wizard of Waukesha, with a look at his pioneering work in multi-track recording. We have an article up at WPR.org with some cool pictures.
And some of you weighed in on Facebook. Mike writes, seems a little remiss to not mention that he invented one of the most iconic guitars.
Mike, good point. I mentioned in the interview that's what I knew more about him. But James writes, I think multi-track recording was his bigger invention. He forever changed the recording industry with that innovation.
And Chris adds, but seriously, his playing is amazing as well. How High the Moon is a great track.
Thanks so much for the comments. You can keep weighing in. You can email wisconsintoday@wpr.org, or you can call or text at 888-642-0232.
Wisconsin Today producers include Mackenzie Crummy, Trevor Hook, and Beatrice Lawrence. Our technical directors are Sarah Hopeful and Tyler Ditter. Learn more about us at wpr.org/Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. You're listening to WPR News.